Hi, my name is Tina, your surgical scheduling coordinator. My team and I will be guiding you through the process of getting you set up for your upcoming surgery. Our goal is to make sure you fully understand all the steps and that all your questions have been answered. Your ophthalmologist has recommended surgery as the best option for your condition after discussing all the risks, benefits, and alternative therapies. Although this has been chosen as the best course of action for your condition, there is no guarantee of the surgical outcome.
When you have diabetes, your body does not use or store sugar properly. This can cause changes in the vessels that carry blood throughout your body, including your eyes. These blood vessel changes can damage your eye's retina, harming your vision. This eye disease is called diabetic retinopathy. Your ophthalmologist has chosen to treat your diabetic eye disease with vitrectomy surgery to help improve your vision. To understand how diabetic eye disease affects your vision, let's take a look at how the eye works. Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, the light-sensitive tissue lining the back of the eye. The retina has two areas: the peripheral retina, which gives us our side or wide-angle vision, and the macula, the small area at the center of the retina. The macula gives us our pinpoint vision, allowing us to see detail clearly. Proliferative Diabetic Retinopathy, or PDR, is a stage of diabetic eye disease where abnormal blood vessels begin to grow on the surface of the retina. This is called neovascularization. With PDR, many blood vessels in the retina close off, keeping blood from flowing properly to the retina. The retina responds to this problem by trying to grow new blood vessels. However, these new abnormal vessels do not provide proper blood flow. They can also bleed as well as lead to scar tissue, which may cause the retina to wrinkle or even detach from the back of the eye. Your ophthalmologist has recommended a vitrectomy because there is retinal scarring or detachment in your eye, or there may be bleeding in the vitreous of your eye. It is usually done in an operating room as an outpatient procedure. During vitrectomy surgery, your ophthalmologist will use an operating microscope and small surgical instruments to remove the vitreous gel and blood from the back of your eye. This allows light rays to focus properly on the retina again. Scar tissue might be removed from the retinal surface so that the retina can return to its normal location. Laser treatment also may be used to prevent abnormal blood vessels from growing on the retina. To help your retina heal in place, your ophthalmologist may place a gas or oil bubble in the vitreous space. You may be told to keep your head in certain positions while the bubble helps hold the retina in place. It's important to follow your ophthalmologist's instructions so your eye will heal properly. As with any procedure, there are risks of side effects and complications with vitrectomy surgery. These may include bleeding, eye infection, retinal detachment, which is when the retina pulls away from the back of the eye, new or recurring scar tissue inside the eye, clouding or scarring of the cornea, clouding of the lens of the eye, or cataract, a droopy eyelid, increased pressure in the eye called glaucoma, vision loss, and the possible need for more treatment, including medication and surgery. Also, your eye problem could remain or get worse. Other treatment options may be available for your diabetic retinopathy. Depending on what your ophthalmologist sees in your eye, these options could include medication injection or other surgery. Your ophthalmologist can explain why he or she chose vitrectomy surgery for your particular course of treatment. You do not have to be treated for your diabetic retinopathy. However, if left untreated, retinal bleeding, scarring, or detachment can lead to vision loss and maybe even loss of the eye. The main goal of treating diabetic eye disease is to prevent further loss of vision. Treatment does not cure diabetic retinopathy, but it is often effective in helping you keep your sight. Be sure to keep all appointments with your ophthalmologist after treatments. Also, if you have any changes in your vision, you should call your ophthalmologist right away. Monitoring your vision is a vital step toward the goal of preserving your sight.
In each consent, it explains that other physicians, medical students, and/or qualified surgery staff may assist in the surgery. However, no individuals will perform tasks outside of their scope of practice. Here it explains the risks of general anesthesia and spinal or epidural anesthesia. This does not pertain to your procedure. On rare occasions, we will have a patient that needs general anesthesia, but for the vast majority of the cases the surgeons perform, they use the minor anesthesia care approach, meaning you are given a combination of a local anesthesia along with mild sedation. During your procedure, unforeseen conditions may arise. By signing this consent, you authorize your doctor to perform any additional procedures that are in his or her judgment deemed medically necessary due to any unforeseen condition. You agree to allow the hospital or surgery center to dispose of and/or study tissues or fluids that may be removed during your procedure. You consent to any medical photography for educational purposes by the hospital staff in which your identity will not be revealed. You consent to the administration of blood or blood products intraoperatively in an emergency situation as deemed medically necessary by your surgeon or anesthesiologist. You give permission for physicians, nurses, medical students, interns, or residents observing as part of the educational process approved by the hospital to be present. At the bottom of the consent form, there is a line for you to sign your name. By signing, you acknowledge that you understand and agree to the terms and conditions we just discussed. If you have any concerns or further questions, please let us know right away so we can address these with you. My team and I look forward to working with you and making this experience as easy as possible. Either I or one of my team members will be contacting you soon to get this process started. Please feel free to contact us at any time with any further questions. Take care.